Good morning. My name is Hal Blatman. I'm the medical director of the Blatman Health and Wellness Center based in Cincinnati, Ohio, with offices in Manhattan and also some presence in Seattle, Washington. And I'm here today with Clint Cornell. Clint, good morning.
Good morning, Dr. Blatman. Thanks for having me here today. I'm a physician assistant with Next Direct Primary Care. We're located in Kenwood, just north of Cincinnati, Ohio.
We're going to talk today about chronic fatigue syndrome. You know, you see a lot of it. You treat a lot of it yourself, don't you?
We sure do. It's a very common reason people seek out medical care.
Yeah, if it's not pain, it's just they're really tired, they're fatigued, they can't get their stuff done, and they've pushed their body for so long perhaps. Or when I look at chronic fatigue syndrome, I think of it in five different categories that are not exclusive, because you can have more than one at a time going on, as we all know. But the big categories are energy production, like mitochondrial fatigue. Our energy factories can't work well. We might be sick, illness, Lyme, mold, Epstein-Barr, number of things that could do that. Our adrenal glands are tired, something that's called adrenal fatigue, too much stress for too long. Our food may not have enough octane for the needs that what we're giving our body to do, some form, I guess, of malnutrition. And lastly, toxicology, the low-level, daily accumulated burden of poisons, heavy metals. We've all heard about lead poisoning now. So those things lead to fatigue too. Can you think of anything else?
Yeah, a couple of things that come to mind. Certainly hormone imbalance, especially as people begin to age. That can definitely be a contributor. Also, thyroid dysregulation. We look at thyroid very differently in our practice, and I know you do as well. We have much stricter criteria when we look at blood results to suggest that there may be thyroid issues going on. And I think that's a very commonly missed area that contributes to this problem. But
I totally agree.
Yeah.
People will come in and their doctors tested their thyroid and everything's normal. And they'll come in and they're on a medication called Synthroid or levothyroxine. Of course, now their thyroid is being treated. How do you figure it out from there?
Well, we look at certainly symptoms. We look at body temperature. That's a great indicator for how the thyroid is working. We look for the presence of antibodies against the thyroid. There are a couple different antibodies that we look at. And then our laboratory tests, the numbers that we look at that tell us the thyroid is working well or not, they're much stricter criteria. And so looking at all of those things, we get a much clearer idea of how well or not so well the thyroid is working.
Yeah, I totally agree. We run the same lab tests, and I tell people, and just to suggest to them, because sometimes you just need those extra words to help get through. And it's like, well, how do your fingernails grow? Oh, my fingernails, they don't grow, they chip and crack. How dry is your skin? Oh, it's not dry. I put lotion on it every day.
Yeah.
Those are the things that mean you've got a low thyroid response. And sometimes you have antibodies your doctor didn't test for, just like you mentioned, that are eating some of the thyroid medicine. Sometimes your receptors don't work. There's so many things. You don't need a lab test to show your thyroid's low if your body's already told you by your fingernails and by your skin and so forth and so on. So thyroid's a great one. Hormone imbalance. That's also really, really important. Can you talk a little bit about that?
Sure. For most of us, as we age, along with other factors, and what we're really talking about here are the sex hormones. Those hormone levels begin to decline. They fall out of balance, and they also don't work as efficiently as they used to. Our body doesn't work, in single unit. It works as a whole machine with different parts working together. And our sex hormones are no different. It requires other parts of the body doing its job in order for those hormones to work. And so we'll look closely at the lab tests along with symptoms. We'll look for imbalance, especially in women. And maybe you want to talk a little bit more about this, but in women who come in, even women who are coming in before the menopause, maybe perimenopausal, we see a lot of imbalance, especially estrogen to progesterone levels. Testosterone levels can be low. And so we focus a lot on that area with our female patients, especially.
And those things lead to fatigue, and they lead to not being motivated to get things done. So very, very important. Let's move on and talk about toxicology, the poisons that people get exposed to, and how do we find out about that?
Yeah, so there's a variety of testing that we can do. We can look for the presence of heavy metals. That's a very common cause for toxic issues. There's a number of ways to do those studies. But first and foremost, you have to identify what the toxic agent is or toxic agents. A lot of times it's more than one, and then figure out how to remove that, how to eliminate the person from being further.
We really have to also. We not only have to get it out of their body, we have to minimize their exposure.
Correct.
We have to get them out of the exposure they're in. And sometimes that exposure can come from things that are already in your body. Sometimes that exposure comes from outside. And so, yeah, that is a very important one. Let's speak a little bit about food. You know, I teach people that your body is somewhat like a high performance biochemical Ferrari. And if you're driving a Ferrari and you decide to go to the track and you stop on the way at the local gas station and put in 87 octane, the car's not going to go around the circle as fast as if you put in 100 octane racing fuel.
You know, food can be a medicine that helps our body function optimally, or it can be a poison. It can be a toxic product. And I think in the United States, and even in most Western cultures, we have a plethora of food, but the food that we have is nutritionally poor. We get a lot of calories, but very low nutrition. The soils that we grow food in is depleted. The growing practices are all about high yields, but there's not a focus on the nutritional quality of the food that we're growing. We also get into the realm of processed foods, and that just totally depletes and destroys the nutritional value of what we're consuming.
So we're eating food that doesn't give our bodies what it needs. That's, a really bad thing for trying to get the most out of what you've got. And we've found people so sensitive. We publish an inflammatory food list on our website. And the tolerance I've seen for people with chronic fatigue for even the small amounts, even a small amount of bread flour, for example, it can bring on fatigue or bring it back when it's on its way out just a little bit. And that extra fatigue can last a few weeks just from the food.
Yeah, it's pretty common. When you talk to patients about their diet, that common response, and I've seen you get it in your office, and I certainly see it in mine. You ask someone how well they're doing eliminating a certain food, and they say, "Well, I'm pretty good." I'm
right.
And I think your famous saying with that is, "There's no partial credit in this," and
that's right.
That's true. Yeah.
Especially with chronic fatigue, when your system is down for the count, and you've really lost so much resilience that you're in that kind of shape, it's really much more difficult for you to recover. You don't get away with the things that you might think you get away with.
Yeah.
All right. Let's move on. Let's talk about adrenal glands. We mentioned thyroid. We've mentioned hormones for the sex hormones. We've already kind of alluded to the idea that the endocrine system is highly involved in this chronic fatigue symptom thing. Let's talk about the adrenal glands.
Yeah, adrenal fatigue is, I'll bet 1 out of 3, 1 out of 4 patients that we see have some element of adrenal fatigue, and it's probably higher than that. But your adrenals are really important in a lot of functions of the body, healing, repair, energy, and others. And when your adrenals are tired, just like our muscles, when we overuse our muscles get tired. Our adrenal glands are no different. We overstimulate the adrenals more often by our lifestyle, lack of sleep, burning the candle at both ends, poor diet, lack of exercise, emotional stress, and the adrenals just get tired and they fail to produce the hormones that they are that they're supposed to produce.
And one of the things that is involved in this field is that they've worked so hard for so long, they get so fatigued. Your get up and go has got up and went. And so how do we figure it out?
Well, again, I think it goes back to, a good history, asking the patient about how they're feeling, the symptoms, the duration, going back. Oftentimes we have to go back years in the patient's history to see this kind of timeline of how their symptoms and health has changed over time. There are tests
I see a lot of times people remember that they burned the candle at both ends for many years, and then when their body started to not want to do it anymore, they kind of whipped the dead horse and fed it caffeine and 5-hour energy drinks and all those things. And, eventually at the end of the day, your body just can't sustain, and then they're down for the count. And real chronic fatigue, you're down in a big way. You get up in the morning, you might shower, and then you've used up your energy for the day, and you're going back to bed. And people look at you and they say, "Well, just get out and do it. Just do a little bit of exercise." And anytime you push yourself, your body pushes you back and steps on you because you don't get away with that. You don't have the tolerance to handle that, and people find that their wall is really firm.
Yeah, there's a patient who comes to mind with this. Every time I talk about this, I think of this gentleman. He worked as a courier, and he was working out of state, had an opportunity to work a lot of hours and make a lot of money doing what he does. And as he was doing that for months and months in a row, he got a call that his mom was sick. He had to come back to Ohio. Unfortunately, she passed away. And that event, coupled with the fact that he had been working so many hours for so long, caused him to crash. And really his adrenals gave out. Unfortunately, he sought out care in traditional medicine, and they put him on opioid painkillers and medicine for anxiety, and that led to a problem with being hooked on those medications. He developed a dependency. And so by the time he saw me, we had years of dependency on medications, and the adrenals were burnt out, and he's doing much better, but he's still got a long way to go. And so I think the take-home message is for people to understand that how they're feeling, what their body is telling them, are important cues, and they really need to seek out care from qualified professionals who can help them, and not just put a Band-Aid on the problem with a pharmaceutical agent.
And I think to that end, the real treatment here is not generally known by the average medical professional. The average nurse has no idea. The average doctor has no idea. But let's go on. We have a couple more things. Sick. A lot of people get fatigued when they're sick, and a lot of people don't know how sick they are.
You know, uh, chronic fatigue syndrome, one of the most common triggers for it is when we get an infection, and quote unquote recover from that infection, but we still feel tired, exhausted, worn out, depressed. We have aches and pains that we didn't have prior. And so there's something obviously going on even after we've recovered from whatever infection it was that attacked us. You know, people oftentimes think of Lyme's disease in terms of post chronic fatigue syndrome after an infection, and that's certainly very common. I think it's often under not identified as often as it
Right.
should be. Yep.
Another one is continued mold exposure and what that's done.
Exactly.
So many things need to be investigated. And then there's the more common things that more people know about, like Epstein-Barr virus and cytomegalovirus and herpes 6 infections, and that can be tested for by we write a prescription, you go to the lab that you've always gone to, and those things can be investigated. So some of these are easier to find, some of these are more difficult to find, and depending on how your body and history and so forth have gone, gives us clues as to what to test for. But those things are also seriously on the list. And now we have COVID.
Right.
That gets to muddy the waters quite a bit.
It sure does. And we're actually seeing people who have become infected with COVID that go into a chronic phase. You know, the heart muscle is affected. The lungs don't function as well as they should. There's some fibrosis that occurs in the lungs of people with COVID. And so that brings in a whole new realm of issues to deal with.
One I didn't think of, and it wasn't even on the list, is medication.
Oh,
Prescribed medication by well-meaning physicians that have either antibiotics that have wiped out your gut flora or dramatically changed it. That is part of this fatigue. Or medicines that have taken away your coenzyme Q10 to reduce your cholesterol. And how many people have muscle fatigue? And heart's a muscle. It's going to have fatigue there too. Brain is actually a muscle. Your parents weren't joking when they told you to exercise it. So, we should at least pass over the idea that there's medications that are commonly prescribed that can be easily part of anyone's chronic fatigue.
I think that's a great point. And I think we tend to take those points for granted. But I think the average person who might be listening to this conversation, they don't necessarily think right away that the list of 8 or 9 medications that their doctor has put them on over the years might be actually making them feel sick.
And there are common medications that you could possibly even just Google and look up that deplete your B vitamins. And here you are taking your medicine, your B vitamins are, really depleted, and that's your energy system.
You brought up a great point with antibiotics destroying good, healthy bacteria. We talk so often about the importance of the gut and how the gut really helps regulate all other body function. Even the brain is told what to do in some degree by the gut. And so when we take antibiotics for every sniffle or ailment that we call the doctor for, we're just destroying those healthy, beneficial bacteria that are giving guidance to the rest of the body to work the way that it's supposed to. So, great point on that.
Very few of us really realize, and it is becoming much more in vogue to understand that we are not the only ones living in our body.
Yes.
And we've got good guys and bad guys, and part of the name of the game in even treating, maybe especially treating chronic fatigue, is to stop feeding the bad guys and encourage the good guys and encourage the biodiversity. The more different kinds of critters you have, the better off you are. We have one more on our list before we close for the day, and that is energy production. Here we are as we get older. We have thousands of energy factories in every cell in our body. We call them mitochondria. We do all kinds of things to stress them out, make them function less. And sometimes you're a 40-year-old person walking around with 60-year-old mitochondria because you've been taking medicines that make them not work. You've been putting heavy metals in your body just by walking around out in your yard that fall down from the sky, and then you walk inside your house with your outdoor shoes on. All these things affect your mitochondria. Let's talk about that a little bit.
Yeah, this is actually one of my favorite topics to talk about because everything else that we've been really discussing eventually has an effect negatively on the mitochondria. That's, we call the mitochondria the powerhouse of the cell. It's where our energy comes from. And if you look at the conversations being had in science and medicine, there really are two camps. One side who sees disease and illness as more of a genetically related issue, and then on the other side of the other camp are those who view disease and illness in terms of mitochondrial dysfunction. And unfortunately, we've kind of have this battle taking place in science between those two camps. I think you and I both tend to fall more on the side of most disease comes from mitochondrial dysfunction, and that can lead to genes being turned on or turned off, which is definitely a much more hopeful concept because we can change mitochondrial disease. The folks on the side who believe this is more genetics, you're just born with it, well, there's not much hope for change with that philosophy.
That philosophy about genetics really people need to understand, and they need to hear, and many of them haven't. 91% of our genetic structure is changeable by what we eat. So if you think that your genetic structure dooms you to something, you can change 91% of that because you turn genes on and turn genes off by what you eat, by what's called substrate, what the genes are going to act on. And so a lot of this treatment and healing is all about exploiting the knowledge of that and helping your body get it right. We also, and one of the most fascinating things to look up is ozone therapies.
Yeah.
One of the best ways to quickly rejuvenate someone's mitochondrial function is ozonated oxygen treatments, which anybody can go and look up. There's lots to read about it. And you can see why there are claims on the internet that it can help almost anything. Because like what you said, at the basis of a lot of disease and illness is the mitochondria are tired, the cells can't do their job, and so you're sick and fatigued because you can't work on your insides can't work. Your outsides look really good, but your insides are really tired. And this is a way, and if you can untired and recharge your mitochondrial function, most any illness you have, your immune system will work better, your brain will work better, your blood will deliver oxygen better. Most anything you do will work better. So people who are fortunate enough to have exposure to that have a really good tool.
Yeah, I think an important point to that is that ozone therapy is really backed up by research and science. We can look at the health of the mitochondria, test called the telomere analysis. We can look at the length of their telomere and really get an idea of their mitochondrial health. And when you look at folks who have received ozone therapy, we see improvement in telomere length. So there's actually science to back that up.
There's a lot of really fascinating science. There's a doctor named Schallenberger who has done some wonderful research about putting people on a bicycle and then measuring the gases going in and out of their body and measuring how long does it take to switch from aerobic to anaerobic metabolism. And now all of a sudden you're making a lot of lactic acid in your muscles. So, which also you now have to work on, that your body has to expend energy for to recover from the exercise that you had. And that's also turns out to be chronic fatigue. So if you can delay anaerobic metabolism and burn fuel in the presence of oxygen longer, you're much more efficient in your energy production and much less toxic from metabolic waste that your body now has to deal with.
Great point.
Well, I think we've covered this pretty well. We've given people a real good introduction to maybe not exactly how to treat it, because that is a lot and a long debate. But we've really introduced how to think about it, how to consider it, where to even start to go, so that you can start to ask the doctor that you're seeing, what about this doc? What about that doc? And then do your own research, and because you are your best inner physician, you are your best inner guide. If you don't take an active part in your healthcare and you just depend on the medical consultants that you're seeing to know and have all the answers, well, you're working at a deficit, and you could really participate and get a whole lot more for what you're doing just by that participation.
I think that's a great point and a great place to maybe wrap this up. I think what's very clear from the conversation is that this issue of chronic fatigue and so many of the other symptoms that are often affiliated with that condition, it's a very complex problem. And the average 4.5-minute doctor's visit is not going to be sufficient to even begin to scratch the surface. And if you aren't your own advocate, if you don't advocate for yourself as a patient, no one else is going to advocate for you. So it has to start there.
And we mentioned lots of things that contribute to this chronic fatigue. If you handle 3 of them in your treatment program and you miss the other ones and you're not getting better, it's maybe because your system's lost enough resilience that you need to do all of them. And maybe there's ones we haven't mentioned yet that other people will come to, because there's all kinds of mind, body, spirit pieces that are also in this. You mentioned that the gut drives the brain, or the brain drives the rest of the body also. So there's such an integrated system. Don't think that if you've done part of this and you're not better, that that's enough. If you're still eating something on the inflammatory food list and you've done everything else on here, that might be all it takes to keep you miserable. Well, folks, we hope you've gained some really wonderful insights into how we think of chronic fatigue syndrome. I'm Hal Blatman, Medical Director of the Blatman Health and Wellness Center, and you are?
Clint Cornell, Physician Assistant with NextDirect and Health Educator. We're both here because we want you to be informed, we want you to be empowered, and we want you to achieve a higher level of health and wellness. Thanks for joining us.
Have a good day. We'll see you next time. Bye now.